Great, welcome everybody. We will get started in just a moment. I'm seeing folks trickling in, so we're just going to give folks a couple of moments to join. Okay, we've got a lot of content today, so I'm going to go ahead and get us started. Welcome everybody. This is our first webinar in a while. So we're calling it today, so you're thinking about reopening safety considerations for congregations, and we're going to hear from Reverend Nicholas Hood from a Detroit church. We have got Dr. Pamela Pugh, who's going to bring some public health information and recommendations for us, and then we're going to get into some building ventilation recommendations from Sonya Pouncy. So if you are new to Michigan IPL, this is just a little bit about us. Our mission is to inspire and equip people of faith to exercise stewardship of and love for all creation. And we focus on a couple of ways to do this. So we try to support congregations, people of faith and conscience in putting their faith into action. And our areas of focus have traditionally been energy efficiency, renewable energy, and other sustainable practices. And the vision that we're working towards is a cleaner, healthier, and more just world. So if folks could just, I would love to hear from all of you who are here as participants. So what I'm asking you to do is if you type in the chat, and you should be able to see along the bottom of your screen, I've put a little image there. You should see a chat icon. If you click on that and then just type in your congregation, your city, and your role, that would be awesome, just to get a picture of who is in the room. And I'll read them aloud as I see them come in. So we have got a pastor from Fort Street Presbyterian Church in Detroit. We have got a Darsha, who's a member of St. Peter's Episcopal Church in Detroit. Central United Methodist, we've got Pastor Jill Zundell. We've got Charles Packer, who's the pastor at Pine Hill Congregation in West Bloomfield. We've got Arlene Frank, who's the executive director of the Downtown Synagogue. Awesome, welcome everybody. We've got Royal Oak First United Methodist office manager. We've got somebody from Chicago, from Pilgrim Lutheran Church, from the worship committee there, welcome. Emmanuel Episcopal Church in Hastings, we've got the rector. Meadowbrook Congregational Church, we've got the pastor, that's Church in Novi. Pastor of Congregational Church of Birmingham UCC in Bloomfield Hills. Got someone from Grace Lutheran in Lansing. Another person from Congregational Church of Birmingham UCC. An elder from First Pres in Northville. Christ Church Detroit, Adat Shalom, Lord of Lords Church, Pastor Glass. Great, Beth Israel in Ann Arbor, UU's in Brighton, Jesus Disciple Fellowship in Tampa, Florida. All right. Fantastic. Okay, so a lot of Michigan folks, a few non-Michigan folks. That is great. Welcome everybody, and thanks for introducing yourselves. Okay, this is our agenda for today. We've just done the brief welcome. I know that folks are probably more familiar with Zoom than they ever wanted to be at this point of our coronavirus quarantine, but I will do a little orientation for folks who are new. We're going to do a quick poll. So we know that congregations are all over the place when it comes to doing services virtually, reopening. I'm just going to do a quick poll so we can kind of see a little bit more about who's in the room and where your congregation is in that process. Then we're going to bring you our first panelist, Reverend Dr. Nicholas Hood, who will bring the perspective of a Christian pastor in this situation. We're then going to shift to hear from Dr. Pamela Pugh, who's going to bring us a public health perspective and some recommendations for congregation. And then lastly, we're going to get into some building ventilation recommendations for reducing COVID-19 risks, and that is going to be with Michigan IPL board member Sonya Pouncy. All right, just a quick Zoom tour. So you should be able to toggle back and forth in the upper right part of your screen between speaker view and maybe it says gallery view. So you can just click that and play around. One will show you one of the speakers who's speaking right now, and another will show you all of the panelists. You can also change the size of your screen. There should be a gray bar that sort of runs between, where the video is on the right and where the presentation is on the left. You can drag it back and forth to change the size. And then lastly, when we get to Q&A parts, we're going to ask you to raise your hand so that we can unmute you to ask your question. And also just a reminder that that chat button below, my colleague Jennifer Young is going to be monitoring that. So you can type a question in there anytime and we'll return to it during Q&A. Or if you've got logistical questions, you can also ask that there. Okay. Just a couple of notes. Yes, we will send you the recording. Yes, we will send you these slides. There's a lot of information, and we've set aside a lot of time for Q&A. And again, you can type your questions in the chat whenever. Okay, so we've got an interfaith audience. Folks are coming from lots of different places. They're putting out clever signage about, advising congregations, how do we move forward with all of this? So we hope that we'll be able to bring you some information and perspectives that will help you figure out how to proceed in your congregations. So let's start with that poll. Jennifer, please go ahead and share the poll. And it should be really apparent when that comes up, where all of you can choose the option that best applies. So my congregation is currently holding in-person services, planning to reopen in the next 1 to 2 months, or lastly, does not have a current timeline for reopening. And we'll show you the results if you can't see them on your screens yet. We'll give another 30 seconds or so for you to fill out that poll. See, most of you have already voted, so that's great. Okay, I'll just give it another few seconds. Okay, so you're seeing the results here. All right, so definitely in the large majority, 67%, two-thirds of congregations attending now don't have a current timeline for reopening. 21% are planning to reopen in the next 1 to 2 months, and about 13% are currently holding in-person services. All right, so thank you for that. That will be really useful for our panelists to know. Okay. So without further ado, I'm going to turn it over to Reverend Dr. Nicholas Hood. He is the senior pastor of Plymouth United Church of Christ in Detroit. Welcome, Reverend Hood.
Thank you very much, Leah. I want to thank Leah, Jennifer, and Sonya for your organization, Dr. Pugh, for inviting me to be a part of this panel today. I say good morning to those who are participating. Depending on your time zone, good afternoon to others. I also want to say welcome to my colleagues in the ministry. Some of the names that you mentioned, I do know. So I'm tickled and honored to be a part of today's presentation. Let me share with you this. I pastor the Plymouth United Church of Christ, located in the heart of Detroit. as I like to say, the tip top of the medical center area of Detroit. We're a congregation of about 950 family giving units. We are a congregation that began, ironically, 101 years ago during the middle of the last pandemic. And I didn't realize that until this pandemic, because there's nothing in our church records that talks about the church in a pandemic. That being said, my church was founded by 9 people, and it has grown, as I said, to now over 950 family units. We have gone to virtual worship during the pandemic, and I will have to admit, as I'm sure many of the clergy who are on the line will have to admit, this is the most challenging time of my ministry because there's nothing in divinity school, theological seminary, that prepares you for something like this on one hand. But on the other hand, I think I am uniquely prepared, expertly, prepared to lead the church during this time. And in an ironic way, even though we're worshiping virtually, we have not had an in-person worship service since, I think it was the second Sunday in March. And what I've done is I've encouraged church members to make their offering to the church, their donation, their contribution via the mail. Now, I do have some trustees in my church who've urged us to step up the online giving. And we do that. You know, we receive donations through the ACH, through PayPal, through Givelify, and we're adding Cash App. But frankly, I prefer just the old-fashioned way, inviting people, encouraging people to give out, to write a check and put it in the mail, because there's no service charge. Now, I know today's program is not about taking up an offering in the church, but you have a lot of people who are watching this who are very concerned about the offering. Just by the names that you mentioned, I know that we are all concerned about it. So that's one thing. But let me share with you what we're doing as we lead towards and move towards reopening. Number one, we've gone to virtual worship. And what I mean by that is I have a scaled down worship music team. It's 5 individuals, 4 men, 1 woman. And I have 3 media people, and they control the light and the sound. And there's no choir. And we did that instinctively. There's not a choir. And then I just go for it. I preach, I pray, and that's it. You know, no announcements. And guess what? What I'm finding is that our online presence has tripled the in-person presence. Before the pandemic, we were getting, luckily, 500 people between 2 services. Now we are averaging about 1,400 to 1,500 people per Sunday who are watching the service. And I suspect that a lot of those persons are not members of the church. Let me give you some very specific things that you can take away from today's program. It's funny. I urge my wife is the chief judge of the federal court in Detroit, and she's responsible for figuring out how they open up. And I said, well, you know, the city of Detroit has a COVID-19 team. I wasn't even thinking about my church. I said, why don't you call them? And I said, by the way, the 2 of those members are members of our church. And so she had them walk through the federal court, and she was just raving about it. And she said, Nick, guess what? I said, what? She said, it's free. She said they came through, they went through every space in the building, and it's free. And so I said, well, doggone it, I'm going to ask them to come to the church. So they did. And I have about 13 suggestions. And Leah, I see you have them up on the screen. Number 1, wear a mask. These were recommendations from the City of Detroit COVID-19 team. Those of you who are in Detroit or in the Detroit area, you can invite them to come to your church. And I bet you they will walk through your church and give you suggestions on every space where people congregate. Number two, be mindful of social distancing. Uh, Number three, refrain from choral singings. They even suggested we put up the hymnals. I don't think we need to do that. It's a funny thing, going to virtual worship, we have made our worship service now available on smartphones and tablets. So we've gone paperless. But they are very concerned about choral singing spreading the virus. And along with that, no choir rehearsals. Number five, limit the microphone use to one person per service, per microphone. And their point was that the unintentional spit or saliva, dewdrops of condensation that might, come together on a microphone cannot be easily cleaned. They suggested you could put a windscreen on top of the windscreen that comes with a microphone, but they say to properly clean the microphone, you have to take off the windscreen and go under it. And during a worship service, particularly a church like mine, where prior to the pandemic, we had multiple services, there's not time to do that. Number seven, they encourage us to put up plastic shields between the speakers and the audience, which is something we have not done yet. We're looking for the screens right now. Number eight, they encourage that trustees and ushers and anybody who handles money in the church would use masks and gloves. Well, my trustees are doing that now. I have a trustee team that comes in immediately following the virtual worship, and they count the offering with gloves and masks. Number nine, they encourage family and close friend groups, kinship groups, to sit together. The thought being that these individuals may already, have been exposed to each other, and so forth. Number 10, make sure that hand sanitizer is available. If it's possible, if you're going to have multiple services, try to wipe down services after worship. Number 12, while the weather's nice, focus on outdoor worship and, weather permitting. And note, I've already conducted 2 memorial services outside, which is extraordinary. And, when I first started thinking about it, I said, this is really weird. But the other side of it is, when we do a typical funeral, we will have the body inside the church with the casket open. I actually had one funeral with the casket open outside a very decorative entrance to the church. And I had a cremation last Saturday outside the church. The COVID-19 team from the city of Detroit suggested that my church consider, when we reopen the church, not to reopen in the sanctuary. This is an important point to the clergy who are looking at this, or church representatives. And their thought is, well, our lower level has a tile floor in part of it, and exposed concrete in the other. And they said that that is actually a lot easier to keep clean and keep safe. And so the one last thing that I would say to those of you who are watching is take advantage of the moment. This is a challenging time. It's a difficult time, but from my church, what we've done is we've gone to virtual everything. So the Sunday school for children meets by Zoom. We're averaging 29 children. Now normally we would have a attendance of 50 children. We have a total circumference of Sunday school kids at 125 with 250 parents. But the parents seem comfortable with the virtual Sunday school. My adult Sunday school classes are meeting virtually. I have a class for seniors on Wednesdays. They meet by telephone because they're not too comfortable with the computer. All of my church boards are meeting either by Zoom or by telephone conference call. And the point that I'm making is that even though this is an extraordinary time, it's a tremendous time. It's a tremendous opportunity for a church to make money, depending on, and to raise money. My church was able to get one of the PPL loans, and I feel guilty about it. We received $75,000. I feel guilty about it because we're clearing a greater profit during the pandemic than we did before. And that's before and beyond and above PPL. So the point that I'm making is that maybe my church is just blessed. I do know of some churches in Detroit that can't wait to have in-person worship because their whole model is based on getting a lot of people in one place and getting a big offering. We were getting a pretty good offering with a congregation that really is spread out, over a 45-mile circumference. And it's a big challenge. Even before the pandemic, it's a challenge to raise an offering. And so I would just say thank you to particularly the church community that's part of this today. And I'm available to answer any questions that you might have. Again, the City of Detroit's COVID-19 team is led by a man named Hakeem Berry. And if you just go on the city website or call the city health department directly, Hakeem Berry is the chief operating officer for the city, but the mayor has placed him in charge of the COVID-19 team. That is a free resource for you, and I encourage you to take advantage of it. Thank you.
Thank you so much, Reverend Hood. That is an awesome tip about the COVID-19 team. I was not aware of that. And so we will be sending the recording of this. We'll send you the slides, and we'll also dig up that contact information for you. Again, this is Reverend Hood's email as well. So that's fantastic. Thank you so much for sharing. We are going to move forward to Dr. Pamela Pugh. Dr. Pugh is the Vice President of the Michigan State Board of Education. She's also the former Chief Public Health Advisor for the City of Flint. And she is going to be, we're kind of zooming out, we're going to look at COVID-19 and from a public health perspective. So please, Dr. Pugh, thank you so much for joining us. Oh, you are still on mute, Dr. Pugh.
Sorry about that. Thank you for having me. And so that was a wonderful presentation by Reverend Dr. Nick Hood. And I'm so happy to hear that your church is doing well, because we see the church as an essential service. We know that part of our biggest issue is making sure that people not only physically are healthy, but mentally, which is highly dependent on spiritual health and well-being. So it's good to hear that the church is remaining healthy at its greatest time of need. So I'm going to go ahead and let me just get started. I'm a member of the World Outreach Campus, and here in Saginaw, Michigan, my pastor is Hurley J. Coleman Jr. To me, one of the most awesome pastors that you could ever have, or the most. And I'm going to go ahead and ask you to move forward with the slides. If you could let me know when I'm like at the 15-minute mark, just so I'm making sure I'm keeping time, Leah, that would be very helpful. But just to get into some of this techie stuff, what is COVID-19? So in February, the World Health Organization, or the WHO, defined COVID, or coronavirus, CO for coronavirus. There's many coronaviruses, but coronavirus disease 2019. And so that was defined by the World Health Organization in February 11, 2020. It had been previously referred to as some derogatory terms, such as, the China, whatever, or Wuhan flu. And so there was the naming of the actual virus. I'm going to go back, Leah, just 1 minute. So just one of the things that I want to just have you to look at, because you've seen this picture, but just like every other coronavirus, there are spikes that are on, there are proteins that are on the nucleus or the body of the virus. One of the things I do want to point out is the thought that the virus has mutated and is able to be more infectious, not more virulent, doesn't make us more sicker, but the body, those spikes make it easier to be taken up within the human cell. So I'm gonna go ahead and move forward. Again, there are multiple coronaviruses, but this one is new. The virus is SARS-CoV-2. Just a very quick timeline. December 31st is when the first cluster was seen in Wuhan. January 20th in the state of Washington were our first cases here in the States. March 10th was Michigan's first case. On March 11th, the World Health Organization declared it a pandemic, but even more important, the NBA canceled their basketball season, and that got a lot of attention. Somewhere around March 11th, March 12th, March 12th is when Michigan began to close the schools and declared a state of emergency, and we began to, or act in, the executive order acted out. Okay, I'm gonna move forward. I think I got everything there. We know that the symptoms started off as dry cough, fever, respiratory illnesses were the three main causes, but then we started hearing loss of taste, some of the neurological symptoms. A fever was one that we were looking at, but we know now that fatigue is a huge symptom that we're seeing. Muscle aches, sore throat are some of the symptoms. We also know that as far as exposure, we know that the routes of exposure, as Reverend Hood was alluding to, hand, respiratory, it's definitely a respiratory illness, and making sure that we're washing hands, making sure that we're wearing masks, that we're not having the exposure from one another. One of the things that I think we'll get into from the next speaker is one of scientists are now really looking at and declaring the illness being airborne, meaning that when someone coughs, someone sneezes, when someone talks, when someone sings, the virus can become an aerosol, and it can remain in the air and in the atmosphere longer than what was once thought. So that can be up to 3 hours is what we're seeing. So just wanted to make note of that. Here are some international rates. So looking at this, so COVID is present in 213 countries as well as territories. So there's about 13 million cases that are throughout the world, worldwide, and about 600,000 deaths. The United States has the second highest number of deaths and the fourth highest number of cases. So that's pretty much what this is showing. And this is the 15 most populous countries that are impacted by COVID right now. So that's pretty much what this chart is showing. You can go there and you can find the United States. And so we are testing, let me see, in our testing, we're probably fourth per capita for testing. And we have the most deaths, and the second highest cases. Our positivity rate, that you'll hear a lot about the positivity rate right now. The positivity rate is the number of people tested, taking a look at, out of those tested, how many actually are positive for COVID. So our positivity rate is somewhere around 6.6%. The WHO, World Health Organization, suggests that you have 5% over so many days before you start going back to some sort of normalcy, if there is such a thing, but where you're beginning to move about and beginning to open up the economy. So when you look at the fact that the United States has a rate of 6.58, we are moving prematurely. So I'll go ahead, Leah. And then this is looking at the US rates. So looking at Michigan, Michigan has improved. You'll find Michigan somewhere there in the middle. So Michigan at one time we would hover between 2 and 3 around for our cases, deaths. And so we have improved. At this point, Michigan we have a little bit over 6,000 deaths and about 78,000 cases. And so unfortunately that is an improvement, but we do see that we still have quite a ways to go. When we know yesterday that the governor did extend the executive order out until August the 11th. So when we look at between June 14th to July 14th for that month, we did see a 32% increase in hospitalizations. And we also saw a 3 times increase in the 7-day average of cases. And so it was very smart of the governor to do that. But if you look at the testing for Michigan, our positivity rate is at 2.5%, which, relatively speaking, we're not over that 5% threshold. So that is good. So still the 8th most deaths per capita. So go forward. And so I think I went over some of these numbers. This is just looking at how the cases, how we're looking at it and how the state is looking at the cases, how we're trending. This is that month period that the governor used to extend the executive order. There's some data that Johns Hopkins, they have a wonderful website. When you look at the new cases, we are increasing as stated. The good thing is our testing is going up, but our positivity rate is decreasing, which is improvement. And so there's a lot of talk around, like I said, the positivity rate. What you want to see is more testing. We want to increase testing, but what we want to see and what we have to see is cases going down as we increase testing. So the more cases that we see, the more testing we should be doing. Leah, if you can go ahead. So one of the things that we saw from the very beginning, we saw we knew that because of the inequities in our communities throughout this country, in Michigan, we were already feeling the brunt of this disease. I will say on March 14th, I was working with my pastor, another pastor in Benton Harbor, who's a friend, and my niece, who's a doctoral student. We put together something for the churches. I'll share it. I think it's a little bit more outdated than what Reverend Hood provided, but we put something out and we were able to put it out throughout the country. And we put something together just telling churches, hey, there's not that much out here, but these are some things that you need to do. How do you collect money? Because that is important to keep the ministry moving. That shouldn't be something we're ashamed of. DJs are collecting money. Pastors should definitely be taking in tithes. So we wanted to give out how do you switch over to this electronic system? How do you distance? How do you make sure that you're physically distancing, but not socially distancing? So it was March 14th that we were working on that. And so we wanted to give it to the pastors because a lot of them, March 15th would be the last day that they would be having service. On March 14th, as I'm working on the document, had in mind to call my uncle, and I didn't get a chance to do that. And then I learned that he passed suddenly. We later found out that his wife, that he did have some symptoms, and his wife actually did end up testing positive for COVID. I had multiple family members who had gone over who also were impacted and had to quarantine. And then the funeral home, the church that they went to, they all had to quarantine. And so right away, as this was beginning, I had my own personal experience of this, and not being able to funeralize and having to go over to my dad's house and tell him that his eldest brother had passed. It just was not good. So that what helped me was to gain as much information as possible and use everything that I've learned, all of my experiences, to help others to learn more about this illness that we knew was going to impact some populations, African American, Black and Brown communities, more than others. You can go ahead, Leah. Mm-hmm. And so there was a lot of miscommunication. There was, don't wear the mask. It's only one person. It's in China. It's only those people who can travel or who have traveled. Tons of misinformation. I had to work with the family that of their child worked in the hospital and couldn't get the PPE that they needed. And I had another younger friend who reached out. He had all the symptoms and was being sent from hospital to hospital, could not get testing. So I began reaching out to my friends who worked in health, and I saw the disaster that was to come, that we were just not at all prepared. And let me say this, I worked H1N1, which was a previous, what we thought could have been an epidemic or a pandemic, and it was nothing like this. We were able to run simulations. We had a vaccine that we were able to even able to run the simulations as to how that vaccine would be dispersed. So saw all of the warning signs that were there. Go ahead. Some of the other things that we just want to talk about, everybody does not have shelter. When we talk about shelter, that's a safe place. So we talked about sheltering in place. Some people don't have safe place. Whether it's because, there's many people that live in the house, there's an abusive person that lives in the house. We also saw where water was not accessible. So the water to hydrate, the water to wash hands was not accessible to our most vulnerable communities. That to add on to the health disparities that already existed, as well as the forced lifestyle of many people, whether it's that they have to use public transportation, they work in jobs where they're exposed, the stress level that some people live under. All of those are immune suppressors or cause greater exposure. Go ahead, Leah. So Michigan has still, though African Americans are 14% of the population, Michigan's death rate, those deaths of African Americans still hovers around 40%. It hasn't really moved from that. And you can go ahead, Leah. And so then looking at some of the places, we know Detroit has been hardest hit. Detroit makes up 7% of our total state's population. However, for the deaths, they're 23% of the deaths. But these are the top 10 counties in Michigan. Detroit has its own health department by Public Health Act. And so they report separate, but I just pulled the top counties and the city of Detroit by cases. You'll see Michigan Department of Corrections, actually I put that in there by accident just because the way it sorted out, they were at the top. So this is the number. To the far right, you will see what's called the fatality rate. That means that's the number of people with the case who end up dying. Michigan for a long time had one of the highest fatality rates. That we hovered at the highest. I did not calculate Michigan's fatality rate. So I'm not sure where we are in comparison to other states. But you'll look and see that 12% of fatality rate is pretty high. I think Michigan's has gone down. I can look that up. But, you have some pretty high fatality rates there, 12%. Okay, go ahead, Leah. So when we look at the cases by race, you can break it down two ways, and you look at it per 100% population. So it's a per capita rate. So African Americans, crude rates versus here is age adjusted. So if you have a community that has an elderly population or a younger population, in red, this number adjusts for that. So when you look at, so when you look at that, that number, if you just compared the Black to white, So that's the highest rate to, well, almost the lowest rate. Well, the lowest rate, the white. And so when you look at the crude numbers, African Americans are dying at a rate 4 times that of, their rate is 4 times that of whites. When you adjust for age, then that goes up to 6 times. We're dying at a rate 6 times that of, our rate is 6 times that of whites. And then you can look at that across ethnicities. When you adjust for age, all of the Black and brown communities, their rates go up. So that's the point there. I'm gonna have you go forward, Leah. This is looking at Department of Corrections, and Michigan took an aggressive approach to making sure that they were testing. So I do want to say that. But Michigan has had the highest rate of deaths in the country for folks in the Department of Corrections. So our deaths now, as you saw before, in the Michigan Department of Corrections is 68 deaths, 413, 4,000, over 4,000 cases. And then the other are federal corrections institution where there are Michigan residents, 183 cases and 5 deaths. Okay. Go ahead, Leah. So this is a, how am I doing for time, Leah?
You're good. You just passed the 15-minute mark.
Okay, good. I'm almost done. So I think this is my last slide. So, I do want to say this. My pastor, he has been so thoughtful in making sure that he protects himself, his family, and the congregation. I know that there have been times when he thought that we would be able to go back into the church, and he's thought about it and retracted back. But we've done most of our services just like you, Reverend Hood, the same way. But just 2 weeks ago, 2 Sundays ago, his son, so 2 weeks ago, his son and his son's family, also a pastor in the area who returned back to work, he and his family tested positive for COVID. And so my pastor and his family also had to test, and thank God they tested negative. Reverend TJ Coleman, who I asked you all to pray for, he's doing much better. I got a report that he's doing much better, but he is or was in the hospital. He might still be there. I think he should be getting out soon, but has been hospitalized for a little while. And so, these things hit home. I can't begin to tell you, as I'm sure many of you, how many people that we all know now that have been impacted. And as I said, that I started this in March 14th with my family being impacted and seeing that rippling effect. You just knew, unfortunately, that everybody was going to, or everyone would have potential to be exposed to this illness and contract it. And unfortunately, some would not be here with us. So this slide here talks about the different death projections, and it's really a simulation. You can go in and you can switch it up. You can look at the different projections. If we wear masks, you can look at it, if we go back to normalcy. But these are some numbers that we should be looking at. We really shouldn't have to look at it. The oranges is reality. To the right, those dashed lines are if we do keep the mask, what it would look like. The red is if we ease the any of our current executive orders. And so I will tell you, as the Vice President of the State Board of Education, as a member of a church, I am not at all for us going into, closed spaces. We learned something new just last week. We had over 200 scientists that talked about the virus, as I mentioned, being airborne. So what do we do about our ventilation systems? So, that has been a lot of my time right now, being on calls and getting calls from parents, from school boards, from teachers, just talking about what does this mean for me being in a closed space. So I think, there's 2 points that I talk about is right now is, do we know how the virus is mutating? And it's not to scare anyone because, the pharmaceuticals are being made. But until then, we just know that we have to play our part to not spread this illness that only we can carry. It dies if we don't move. So I think I can stop there, and I think that's it.
Thank you so much, Dr. Pugh. We have built in now to the agenda some time for questions and answer. So again, you can type any questions you have for Dr. Pugh into the chat, or you can click that button on the bottom to raise your hand and we will unmute you. I was noticing, looking at that curve, Dr. Pugh, there was a lot of talk, especially earlier in the pandemic, about flattening the curve. So when I looked at that curve, I was initially alarmed, thinking it meant, rates of infection were, steady and climbing. But then I realized, oh yes, these are the rates of death. And I noticed that the difference between, not wearing masks and wearing masks was projected by November to be the difference of around 1,000 lives in Michigan. So I just wanted to see if I had interpreted that correctly, but that's really significant.
Yes, and I think, my thought and what I always said, let's not focus on flattening the curve. Let's crush the curve, because what we need to know is that there will be a time period where, we could even take off farther because we're going back indoors, and then it's flu season. And then there's going to be such a burden on our medical system. We can talk about the apparatuses not being in place, but let's talk about the people, the humans, those people who work in these facilities who will not have any rest. So I think that, yes, let's make sure that we're wearing our mask. Let's stay at home. I mean, we really need to stay at home. I think as we learn more about, and Sonya will talk about this, but when we learn more about what happens in these building spaces, and we just don't know, we need to know more about that. But yes, we do need to wear a mask. Yes, it makes the difference. Keeping in mind that the mask protects you from me, not me. It doesn't protect me, not the typical mask, but at the same time, and so that's what we're about, right? As Christians, is taking care of one another. So even if you don't care about yourself, care about your brother and your sister. So hopefully that answered the question.
Yes, thank you. So we've got a couple questions from the audience. So I'm going to turn it over to you, Adarsha. You had your hand up. Go ahead and ask your question.
Hi, this is Adarsha. I'm from St. Peter's in Detroit. We have a congregation usually of anywhere between 7 to 12 members. So we're pretty small, but there's also a lot of other things happening at the church. So it's not just the congregation. But my question is there any possibilities about having a small, safe group outdoors, and then also incorporating Zoom with that? So in other words, is there any guidelines for the possibility of safely meeting in a very small group outdoors? Thank you.
Outdoors is so much better than indoors. And our next speaker probably, nod your head if you are, but I think that Sonya is going to, can speak to this as well. But yes, outdoors makes a huge difference. Again, we're still wearing masks. Well, it depends. You want to spread yourself out. You still want to give at least 6 feet, but outdoors is a whole different ball game than being indoors where those aerosols and the smaller particles can stagnate. So yes, I think that there are ways. You still want to write out a plan and you still want to make sure that there's social distancing, there still may be need for masks if there is the chance of coming in contact with your brother or sister. But there is, I think that's much more promising than meeting indoors. And it's a small group. You're talking about a small group.
Great, thank you. Next up, we've got a question from Bishop Williams. Go ahead, Bishop.
Thank you so much, and good afternoon, Dr. Pugh. First of all, I'm a dear friend of your pastor, Hurley Coleman, and I understand his greatness because great leaders have to have great followers. So thank you for being on and sharing your personal tragedies, and you have our condolences there. You mentioned right near the end about ventilation systems helping to spread the virus. This is something that I've only heard of in the last couple of days. Can you share just a little bit more about, for those, I have friends who are back in their sanctuaries, and we're not. We did our first outdoor service this past Sunday. I've tried to encourage my friends without telling them how to pastor their churches to be really, really careful about re-engaging in their sanctuaries. But with this added concern about ventilation, can you explain that just a little bit more?
Yeah, and I think, Sonya, you're going to speak to this in a minute, right? Okay, all right. I'm seeing her nod her head. So all I can say is that I don't know. And Sonya probably can answer it better, but I believe it, and I've been reading about it. I can say my bachelor's degree is in chemical engineering. So I think it was like Tuesday, after I was getting tons of calls about the Detroit schools opening, and we just fought a big case about the schools not having air in the summer and heat in the winter. So their ventilation systems are just of most schools. So it's a concern. So I started thinking back to my fluid flow and airflow and air dynamics classes, and I really dug into the reading of those that's gave those 200 or so scientists just last week the impetus to push the World Health Organization to do this statement. I will say that I was on a call yesterday where there's just very little science. So I'm really happy to be on here with Sonya to hear from her. But all I'm going to say is the fact that we don't know, and we're talking about a deadly virus that could also be mutating in a way that that it's more easily and more readily taken up in the system gives me pause around this reopening, around kids going back to school, churches opening, me going to the grocery store haphazardly, people not wearing masks. It gives me that much more pause. It makes me think I need to keep myself at home and physically, distancing as much as possible. But I do think we need to continue to take heed to that. I think that you telling your fellow colleagues sharing that information with them is right where we need to be. And that's what I've been doing, is making sure that all of our education folks, that they're not just talking about technology and putting computers in people's hands, but they're also getting some people in that are mechanical engineers. Sonya, I think I have another project that I hope to be able to bring you in on, because we talk about citing, a school citing, and we just released a report. I'm on a team with the University of Michigan, and it was funny because as we were doing the research, a Flint water crisis happened, so we had to kind of like pull back and make sure that we were including that into the report. They just released the report again, and I was calling Dr. Mohai, the professor, and Beyonce, and I said, hey, we got a whole other thing that we've got to include in this report. So we're looking at doing an addendum to that report. But again, the science is out there, but it's just like masks. I don't know, you probably recall, they were telling you, don't wear masks, don't put that on, don't do it, it's gonna do more harm. So I think that we may be in a place just like that, is that we may find out that we have to, well, I'm gonna let Sonya, I don't wanna preempt what she's gonna say. But for me, it's given me enough to give pause and to make sure that the folks in Detroit, the folks at any other school is thinking about ventilation. And there was a report, and Sonya may speak to this too, where, you know, maybe even when the choir was singing, that it could have, the air conditioning in the building could have helped to spread the virus more. So lot to learn there.
Thank you so much, Dr. Pugh. And we are going to move forward to Sonya Pouncy. Let me just share my screen again, and we will launch into her presentation. So we have next Sonya Pouncy, who has so many letters after her name, and I only know what some of them stand for. She is a certified energy manager. She is a lead AP, that's the U.S. Green Building Council designation for energy efficiency design professionals, I believe. She's a consultant at Building Vitals LLC, and she is also, I'm proud to say, our Michigan IPL board treasurer. Welcome, Sonya.
Thank you, Leah. And thank you to Reverend Hood, who is my spiritual leader, my pastor, and to Dr. Pamela Pugh. Both of you provided very enlightening and edifying presentations. So I appreciate being a part of this panel. Can you hear me well enough? I feel like I'm a little, okay, great, perfect. So next slide. Okay, so this is not a company that I work for. ASHRAE is a 501c3. It's a nonprofit organization, but I'm here somewhat wearing my ASHRAE hat. So I'm going to talk a little bit about them because most people don't know who ASHRAE is. So the American Society of Heating, Refrigerating, and Air Conditioning Engineers. And most people think, oh, okay, those are some boring folks, right? The folks hanging out in the mechanical room, or the wrench turners, and the people with oil under their fingernails and all that kind of stuff. So, but just a little bit about who we are and what we do. We are the engineers, largely mechanical, but not all, that design building systems. And specifically, we design HVAC building systems, the environmental control building systems. So if you have a project, a construction project, and you hire an architect, that architect will likely hire an engineer if they don't have an engineer in-house. That engineer will likely be a member of ASHRAE. Right now, being a member of ASHRAE is not a requirement in the industry, but it certainly helps. They provide education and continuing education for industry professionals. So our membership is made up of engineers, architects, designers, planners, anybody who works in the building arts industry. So contractors, people who construct buildings, as well, are members. So our vision is to just, we envision a healthy and sustainable built environment for everybody. And I apologize, it seems I skipped a word on that slide, so that should be built environment there. And we do this by advancing the arts and sciences of HVAC, of heating, ventilation, and air conditioning, and refrigeration as well, and their related fields. So next slide. So ASHRAE writes, does a number of things. One of the things that we do is we write standards. And these standards are often used as models for state codes for various aspects of building construction. So for example, here you see two ASHRAE standards. 90.1 is our energy standard for buildings, for commercial buildings, new construction. And behind that there you see the Michigan Energy Code. So the Michigan Energy Code is based on the ASHRAE standard, right? So if you buy the Michigan Energy Code and you're looking through that to figure out what energy regulations or requirements you have for a facility, that code is going to tell you, go to this ASHRAE document, right? The second slide, or the second image that you see here is the ventilation for acceptable indoor air quality. ASHRAE standard 62.1. We have a ventilation standard for both commercial and residential buildings. This is the commercial building standard. And it is similar to Michigan's mechanical code. Michigan's mechanical code has a ventilation section to it, which is somewhat based on the ASHRAE document. There are other organizations that write standards as well. And so this particular Michigan standard is a little bit more based on the international mechanical code, but that document as well references the ASHRAE document, and the ASHRAE standard is usually used as a alternate route to compliance for those building aspects that require these codes. Next slide, please. So ASHRAE has, again, because we are the HVAC professionals, we're the ones who design HVAC systems for buildings. Very early in the advent of this pandemic, we recognized that the world was going to need our assistance and guidance in terms of how to handle buildings. And I also want to say, I did say the world, because although the organization is called the American Society, we are actually international, right? With 55,000 members worldwide in 192 countries across the globe. So we've got this website here, or this landing page on our existing website, specifically dedicated to providing resources for COVID-19. If you've got a question, you can email the organization at covid19@ashray.org. And you can see here at the bottom that we've got some sections, some information on reopening your building, right? We've got things for reopening schools and various types of facilities. We've got some information on filtration and disinfection. Those were some questions that people had. And so we provided some FAQs there. We've got information on transportation, what happens in your car, what happens on a train, what happens on a plane. And then we've got some other, just some other resources as well. Next slide, please. Okay, hopefully this works properly, because in PowerPoint things do one thing, and then when they get on Google they tend to do something else. But this is just a snapshot of the CDC's website. So again, because lots of folks haven't heard of ASHRAE, and you think, oh, well, who is this organization and why are they telling me anything that I should be doing about my building? Why should I listen to them? Well, if you look at the CDC's website for COVID-19, they have a number of resources for you that are available free from their website. And you can see here, if you don't have to click next slide. It should pop up. Yep, right there in the middle of the page, right? ASHRAE Standard 180. So that is our standard for maintenance and inspection of HVAC equipment in buildings. Next slide. And we also show up on their website, again, with our recommendations for commercial buildings under epidemic conditions. So we've got a list of recommendations for how to operate your building under an epidemic, like we are right now, and then also how to return your building to normal operation. Next slide. And you can see that reference there. Next slide. Thank you. All right, so building uses. Well, when we look at buildings, right, we use them for a number of purposes. With our houses of worship, right, they typically are not just houses of worship, right? We use these facilities as community centers. Many of them have banquet facilities. We use them for weddings, for coming of age ceremonies, for holidays and other life events, right? And some of them have schools that they house as well. And in this regard, our houses of worship are just like other buildings that we use for entertainment or government or healthcare or manufacturing. All these buildings provide environmentally controlled spaces for occupants, activities, and things. Right? So next slide. Thank you. So when we're asked, why are we controlling the environment in these buildings? What are we doing this for? Many of us might think, oh, we do this for comfort, right? And that would largely be correct. A lot of the environmental control in buildings is for comfort, because although we love summer, nobody wants to be hot and sticky and sweaty in July. and nobody wants to be super cold in January, right? But we also control the indoor environment of buildings for certain industrial processes, right? So for example, a meatpacking plant, the temperature would be maintained at 50 degrees or below so that we can reduce the likelihood of growth of any biological or microorganisms, right? We also condition buildings for health, but usually people don't think about that one. They think about healthcare and they think about hospitals, but other buildings, every building, right, is in part designed for human health or with human health in mind as well. If for no other reason than the simple fact that in the US and in other Western countries, the average citizen spends about 90% of their time inside buildings, right? So a good portion of that is certainly at home and at work, although right now, more so at home. But a significant portion of that, or a sizable portion of that, is also in our houses of worship, right? Depending on someone's faith and their particular traditions, that could range anywhere from 2 to 6% of their time, right? A couple hours a week, somebody might be at their house of worship. And so in these spaces, we're concerned with a characteristic called indoor air quality, right? Which I've defined here. It's looking at the attributes of the respirable atmosphere, right? So the breathing zone in the building, right? We're looking at the composition of the air, what's in the air, right? Is it just the air, or are there some other things, some chemicals or things that shouldn't be in there? Is there some pollution in there? We're looking at the humidity of the air. How much moisture can this air hold? Yes, we are concerned with the temperature of the air. And then also other contaminants of the air. So we want to make sure that, so that we understand this is what indoor air quality is. And acceptable indoor air quality is defined as that indoor air with which a substantial majority of people have no objection and no adverse health effects, right? And so that substantial majority would be 80%. So, when we're looking at these indoor environments, we're designing them, the engineers are designing them so that they provide a healthy environment so that everybody has high level of indoor air quality. Now, one of the things listed here is contaminants. So in the midst of this coronavirus pandemic, air cleanliness has taken over center stage, right? Next slide, please. So we are, okay. Okay. Hang on one second, my apologies. My machine is doing something funky here. Okay, so how do we control this indoor environment, right? How do we achieve this indoor air quality that we want? Well, we do that with our HVAC system, our HVAC equipment, the heating, ventilating, and air conditioning equipment. So I know that we have an audience of what I will call lay people, if you will, because you're not HVAC professionals, you are faith leaders of faith-based organizations. So here we just got a quick overview of what the HVAC system looks like and what it does. So I don't know if I have mouse control or you, Leah. I think it's just you, so I'm not going to worry about my mouse, no worries. So down here at the, well, let's look at the space, right? So you've got a group of people here engaged in some prayer, and regardless of whether they're praying or eating or swimming or typing in an office. Oh, please go back. They're generating heat, right? So the human body is generating heat. And there's also a little bit of heat coming off the lights there as well, right? So we've got the sun coming into through the window, and that's bringing in some additional heat. So we've got to get all that heat out of the building. And so this HVAC equipment helps us to do that. So you've got here down at the bottom in the middle, you've got something called a chiller. This is providing the air conditioning, right? We're going to We're going to cool some water down with that chiller, and then we're going to put that water through a coil, and we're going to blow some air over that. And that's going to cool that air down before we bring it back into the space through this supply duct, right? In order to get the heat out of the chiller, because now that water has absorbed heat from the space, we've got to send that hot water to the cooling tower to cool off, right? We've got a boiler here also for your winter months that is going to provide heating for the space when the time comes. So, but the important thing that we're going to be talking about today is this little pink box over here, the air handler, the AHU. This is the device that has your fan, your coils, and you can see over here it's got some dampers to it, right? And so what the air handler is doing is it is the device that is moving air around your building. And you can see here that at the top of the air handler, you've got a return fan, right? So you're taking some air from your space and you're bringing that back to the fan. And some of that air you're going to exhaust out the exhaust air damper, right? And some of it you're going to reuse. So you're going to send that through the return air damper. And down here at the bottom, just below the return air damper, you also have an outdoor air damper where you bring outside air into the building, right? And the combined return air and outside air is what we end up sending back to the space to either absorb your heating or your cooling load as the need may be. So there's not going to be a test on this. There's not a poll or anything, but I just wanted to kind of give you a picture. And I know a picture's worth 1,000 words, so I figured this would be helpful to just understand, what the equipment is doing and where it's kind of located, what it looks like. Next slide, please. Thank you. So,
Sonya, I'm sorry to interrupt, but we're hoping you can wrap up your presentation in about 5 minutes so that we've got plenty of time for Q&A.
Ah, okay. Then let's see here. Skip this slide. So we've got a couple different types of contaminants and that we're looking at to have the air handling system or the HVAC system removed from the facility. These are particulate matter, which includes like pollens and dust, aerosols, some chemicals, formaldehyde, VOCs. These are things that are off-gassing from materials in the space. And then we've got biologicals like bacteria, mold, and the viruses like the coronavirus. Next slide. The big thing that we want to do to help us reduce the risks associated with coronavirus and any other virus in the space is to dilute that space air, right? The air that we're bringing into the space. And how we do that is with ventilation. The more outside air we bring in, the lower the concentration of any pollutants in the air. And we have, so that when I was young in my career, the saying was dilution is the solution to pollution, right? So by ventilating the space, we are able to reduce risks associated with corona. Next slide. I will skip this. Next slide. So just briefly, I'm going to talk in a minute here about things that you can do in your building, what things that you want to change about your ventilation system. But before you make any changes to your ventilation system, I implore you to please certainly engage your building committee, and then also any external facility partners. Those may be your contractor that you use. It may be an engineering firm that you contract with, but certainly reach out to those industry professionals that can assist you with understanding how your system's working, understanding your current state, where you need to go, and then helping you develop a path to get there. You should have some documentation on your equipment and its operation, and I encourage you to take a look at that. Any changes that you're going to make to your system, I encourage you to document them. Right? And then also establish a date, but that you're going to go back and look to see, okay, how are we doing with these changes? Do we need to go back to normal? Is it time to go back to normal? What's going on here, right? You also want to make sure that you've advised everybody of what's going on with the building, particularly your congregants. If you are doing in-person, if you are holding worship in person, so that folks understand that they may not be as comfortable in the building during this temporary period as they were previously, right? So that they can dress accordingly. And so that they understand, oh, I shouldn't be touching these controls, or I shouldn't change this because these are temporarily set back to something else. Next slide. You want to make sure that you also perform your maintenance. And a lot of facilities, I can't stress enough, whenever I'm doing audits or looking at people's buildings, we tend to think maintenance isn't required. Right, and when things are good, when times are good, we say, oh, I don't have to worry about that. And then when times are bad, we say, oh, I can't afford that. Right, maintenance is not a luxury. You spent quite a bit of money on your HVAC equipment and you want it to operate properly. So you've got to do the maintenance. And if your building has been shut down through COVID, then when you get ready to start your building up, you definitely want to go through this guideline here, this standard here, and perform the appropriate maintenance for your equipment. You want to make sure that things are working properly so that when you turn them on, you get what you intend to get. You get what you want. If you find things that are broken, if you've got any deferred maintenance, perform it, do it, fix it, replace it, or repair it. If you're going and looking at your air handler, whether you've got an air handler standalone unit, or if you've got a packaged rooftop unit that has the compressor and everything in it as well, you want to make sure that you clean and disinfect that unit. Looking at the casing itself, the walls, the ceiling, the floors, and the components inside. And we're going to get to those in just a minute. Next slide. I'm going to probably go until, we're supposed to end at 1:30. I'm going to probably go to 1:20, Leah. So just a quick note on filters. I'm not going to belabor this, but I know that lots of folks have questions and people have been hearing, oh, I want to get a MERV 16. I want to get a HEPA filter. You certainly want to, in preparation for making some changes to your ventilation system, right? That air that you're going to be bringing in is going to be going through these filters. So you want to make sure that you've got either clean new filters, or that your filters that are currently installed were recently changed, right? If you're going to replace your filters, you certainly want to get the best filter that you can practically use. And when I say practical, then you need to look at cost, and you also need to look at your system. Filters add pressure drop, and pressure drop impacts the system performance. It impacts your motor, your fan motors. It impacts the comfort of your occupants. So you want to make sure that you pick a filter that has the highest MERV rating that you can get. That also has a pressure drop similar to the filters that were in your system already. If you have MERV 8 filters, I don't necessarily encourage you to go to MERV 13 or MERV 14 without talking to an engineer first. You need some assistance to make sure that those new filters are not going to adversely impact your system performance. Next slide. I'll skip this one. Next slide. So when you get ready to open your building, because I think it was around 67% of you or so have not been holding in-person services. So when you get ready to open your building, one of the main things you're going to want to do is a building flush. You want to flush the air out of your building. You want to have at least 6 air changes, and an air change is the replacement of the entire volume of air in the building. Right. As you're doing this, or in preparation for this, you want to check with your equipment manufacturer if there are any controls updates. There often are, and you want to make sure that your equipment is up to date. You want to make sure that your equipment is operating with the most recent control protocols that it should be. You want to check all of your set points. If anything is off, if your temperatures are off, if your pressures are off, recommission or retro commission your equipment to make sure that things are running as they should be, as they were designed, in accordance with your design documents. And then you want to make sure that you run those air handlers at 100% outside air if you can, right? For at least 4 hours. Again, you're trying to get all of the stale air out of the building and bring in all new fresh air. Now, if your equipment has some limitations and you can't do 100% outside air, then run them long enough to do at least 6 air changes. That may be more than 4 hours, right? Or you might consider also opening some windows and doors. You might consider installing some temporary exhaust fans, right, to assist with that. And then as you're making these changes to your to the equipment, you want to track and trend how the equipment is operating. You want to track and trend the set points. Is it able to meet the temperature set point that you've got that you're asking for? How much energy is it using? So that when you get ready to make some additional changes, you can make informed decisions. Okay, next slide. Word of caution for houses of worship in particular. So when you make some changes to the ventilation system, for example, if you're bringing in 100% outside air, some of these changes will impact the relative humidity in your space, right? When you do this, you want to be careful. You want to take special care. And that this is one of the reasons that you want to have a consultant, either an engineer or some sort of industry professional that can assist you to make sure that you don't create a situation where you're going to have condensation on your windows. Very often houses of worship have ornate windows and they tend to be single pane, right? So that means that even though it may be warm in the space, those windows may be cold, right? And so if that's the case, moisture is going to condense out of that warm air onto those windows, and you will develop additional problems, mold, fungi, mildew, things of that nature that you don't want. Also, houses of worship tend to have, you know, a lot of ornate woodwork and other, you know, carpeting and other materials that, again, you want to protect against too much moisture. Next slide. Next slide. So you want to increase your ventilation rate, the amount of outside air that you're bringing into your facility, which you can see here with this graph. The probability of infection from one congregate goes down significantly when you have more air changes per hour, right? So when you bring in more fresh air, the likelihood that somebody who was sitting in the congregation who sneezed or coughed, right, or who spoke and some droplets flew out of their mouth, right, the likelihood that those will infect somebody else goes down significantly if we can take that stale air or that used air out of the building and bring in some fresh air. Next slide. If you skip it, next slide. If you've got an economizer that is bringing in 100% outside air to help reduce the hours that your compressor has to operate and to improve your facility's energy efficiency, you want to make sure that you lower the changeover temperature. So this piece of equipment will operate down to a certain temperature, right? And then after that, it's not going to provide as much energy efficiency as you would like, because it partially goes off and right, it goes to minimum outside air. So you want to lower that temperature. Next slide. This is an important one. So relative humidity. We talked a bit ago about making sure that you don't have condensation on your surfaces. This is an important slide, and I want to mention here in the scientific community, understand that people have been studying viruses like the coronavirus, right? We've been studying this, you know, since the SARS and the MERS epidemic. So this research is fairly old, and we've got a sizable body of knowledge about how viruses behave in environments. And so with this slide here, what this is showing is that the relative humidity in your space, the optimal relative humidity in your space should be somewhere between 40 and 60%. You want to try to get there, right? Next slide. I'm sorry, and I am gonna, and so, and then after you make any changes to your system, document everything. The worst thing you can do is make some changes and then you change hands, right? One of your building committee leaves and the new person doesn't have a clue of what's going on or what happened or why. And then people start making changes when they don't understand what's going on. They start disabling things. So you want to make sure that you document everything. And when you make any modifications to your ventilation system, you want to make sure that you coordinate those changes with other equipment. You're going to be making changes to your chiller, to your rooftop unit. You want to make sure that you coordinate all of this stuff. These pieces of equipment do not operate in isolation. Next slide. I'm almost done. So in response to Corona, the Detroit chapter of ASHRAE and the Western Michigan chapter of ASHRAE got together and pooled our resources. There are about 1,000 ASHRAE members in Michigan. And we knew that, while our society, our international society has this page and has resources available, we knew that folks right here in Michigan were going to need help as well, and that you likely wanted somebody here local to provide that assistance. So we put together this document that provides recommendations for your HVAC and your domestic water systems, because if your buildings have not been used, you've got issues with your domestic water system as well, and those need to be addressed too. So this document goes over 20 different systems in your building. So it's looking at your HVAC, each individual component. It's looking at your hot water system. It's looking at water fountains, all that sort of stuff. I think that's it. Next slide. All right, these are some additional resources. If you've got some questions, you can email them to ASHRAE at covid19@ashrae.org. And I apologize for, but I felt some of the information was important, so I wanted to get it in. I know that I went over the time you asked, but you've got 4 minutes, so.
Ooh, all right, Sonya, take a breath. Thank you for that. That was a lot of information and really good stuff. I want to open it up to questions. I know definitely several things came to my mind when I was listening to this. One is like, when thinking about air exchange in the buildings, does that presuppose that you've got air conditioning in the summer?
So you don't it doesn't necessarily. So lots of buildings here in Michigan in particular have boilers for their heating. And so older buildings, they may not have air conditioning, so they don't have they don't have a way to, they aren't distributing air around the building. If you've got a packaged rooftop unit, or if you've got furnaces, those types of equipment, definitely you've got air moving through the building. And if you've got a boiler that has that's feeding hot water coils or steam coils in an air handler, then you've got air moving around the building as well. So typically in older buildings where they had boilers and they don't have air conditioning, they had decoupled systems. So there's still an air handler that's moving air around the space. Mm-hmm. And you just have a heating coil in that air handler. They just happen to not have had air conditioning. So there's no compressor, there's no cooling.
Got it. Okay. I see that Arlene has got a question. Arlene, go ahead.
Hi, you can hear me okay?
Yes, we can.
Okay, so I am in an old building with a very old system, although a new boiler because our old boiler broke in December. But we do have air conditioning. We have 2 very, very old units. Mm-hmm. That don't do a particularly good job. No air conditioning has been on since, we have hardly had any heat on when we left the building in March. Mm-hmm. So there's been really no air circulation. And, the question I would have is whether the air conditioning units we have are so old that they're even possible to do any kind of decent filtration, or whether they would provide us with adequate ventilation when we reopen. And secondly, we've been, 2 times or so a week running the water in our faucets and flushing our toilets. And is that sufficient in terms of water not being used over this long period of time, or would we still need to do something different?
With the old equipment, I would encourage you to have an assessment of the equipment and just kind of take a look at it. So you would have a contractor or somebody come through, an engineer or somebody come through, take a look at the equipment and evaluate it and tell you whether or not the equipment can meet your needs, right?
Okay.
Very often with old equipment, it can. Coils can be replaced, filters get replaced. Depends on how well the equipment has been maintained. Sometimes you do need to just chuck it and get something new, but you could replace things, right? That is a possibility. So, but it will require an evaluation. It's not something that I can just tell you here. Somebody would have to look at your specific equipment. As for the water, if you've got somebody going in on a daily basis and you're running all the faucets, right? So you've got no stagnant water, you're pushing the water fountains and letting those run, and you're Looking at the water, your cooler if you've got one off the refrigerator or something like that, like all those water sources, every sink in every bathroom, every toilet, every commode, every urinal, then you may be okay. But if the building has been unoccupied, I would still probably encourage you to at least look at some of the initial criteria for a building water flush. You can do a chemical analysis to make sure that your water supply has the appropriate amount of residual chlorine in the water. Then you're good. But you still want to continue to do your flushing. And then if you don't have the right amount of chlorine in your water, then you absolutely want to go through the procedure and do an entire building flush. And that's really important for a couple of reasons. One, you've got the stagnant water and you've got viruses and things that are just kind of in the water. When the water's sitting like that, the chlorine tends to dissipate. I don't know if any of you have heard of a bacteria called Legionella, but it also causes respiratory illnesses, very similar to what we're seeing with the coronavirus, and it is also can be a very deadly bacteria as well. So you want to make sure that you again just have a good chlorine level.
I put this note in the chat, but I just wanted to say we're going to try to handle all the questions that are coming up. So if you can stick around with us for the next 10 minutes or so, then we will get to all of your questions. And if you have to go, like I said, you'll get the recording. So let's turn it over next to Fonda Brewer, please. Go ahead.
Hi, good morning. Can you hear me okay?
We sure can.
Awesome. My question is for Sonya. Great presentation. We hear a lot at hospitals, you hear negative air rooms as they're addressing COVID issues. Mm-hmm. How does that relate to the ventilation that you're talking about, like the air handling unit? Mm-hmm. Should they tie, is there any correlation?
So when you have spaces are either positively pressured or negatively pressured, right? They're really not neutral. Right, so they're either positive or negative, and that positive or negative is in relation to the air pressure outside, right? So if I've got a positive space, if I'm in a positive space, my pressure is higher than it is outside. That means if I'm in here and I'm sick, air is leaving my space and flowing to a lower pressure, right? Just like water, right? Things flow from high to low. So if I'm in a space that's a high pressure, air is going to be leaving my space and going outside, and that outside might be the hallway, it might be the next office, it might be, the nurse's station, what have you. And so when you have a negative pressure room, the pressure in my space is less than what it is outside. So if there's a leak in my system, air is going to be coming from inside to my space. So if I'm sick and I'm in here coughing, the used air that I've contaminated in here is not leaking out into the other spaces, right? It is being captured by the air handling system and then taken to the air, to the air handler and being cleaned and exhausted and what have you. And so that's kind of how those two things work. So negative pressure or positive pressure, that's part of your air system. Hopefully I answered your question.
You did, thank you.
Okay.
And we'll go next to Keith Hartley. Keith, go ahead.
Hi. Sorry it took so long. I was unmuting my microphone.
No problem.
I am the unit that I have, particularly in the older part of the building, was a converted, it's an old air handling unit, and it was converted to air conditioning. And after the pandemic started back in March, I had turned the heat off, and I have had it on ever since. And I've been circulating the air through the older portion of the building. Now, we had a new sanctuary built in 2008, and we've had nobody in the building other than very few people, like 2 or 3 people. But everyone that walks into the building has a mask on. But I have been running the air conditioning to recirculate the air in the sanctuary, because we also have a food pantry that is downstairs that has been open straight through because we've had to feed people on a regular basis. Everybody that's been in the building has been wearing masks. Everybody in the building downstairs has been wearing masks. I feel confident that we've been following up on sanitation. Myself and my assistant, Eric, he and I have alternated taking care of doorknobs in the areas that are being used, spraying down with disinfectant, what have you. But my main concern is I want to know if what I've done by leaving it on is actually helping, because I am running at 100% outside air right now, but the air conditioning is running also.
Mm-hmm. If the building is not occupied, I would suggest that you look at the need for air conditioning, right? But if you've got some operations going on in there, you've got a food pantry and some certain spaces that need to be kept at certain temperatures. So you might just want to look at what those temperatures are and make sure that you're there, and see if you can maybe tweak those a little bit. Maybe you don't need as much cooling as you thought you needed, or maybe you only need to cool certain spaces in the building. But it sounds like you're doing a great job. If you've got the air running and you're doing 100% outside air, can't ask for more than that, right?
Right.
100%, and it's all the time. So no, it sounds like you're doing a great job. I would just look at, if you're concerned at all about the cost of energy, because I will say, the changes that you make to your facility to help reduce the likelihood, or to help reduce the risks associated with the transmission of viruses will very likely increase your energy use, right? So
right. Well, we were understanding that right from the get-go, and when we went from heat right to air conditioning, I am checking the temperatures in the rooms that are being used, making sure that they're running adequately and that the temperature is not too excelled past a normal. I usually keep it at about 76, usually for comfort, but I have the timer set on the electronic thermostats in the newer building, and they go on and off as needed.
And then at night, when the building is unoccupied, do you let those temperatures drift up? So do you go up to, say, for example, 80 degrees?
Yes, ma'am.
Okay. You're awesome.
Thank you.
Well, I want to thank so much Sonya and all of our panelists, Reverend Hood, Dr. Pugh, for all that you have shared with us today. Thank you so much for being with us. And I have a couple of announcements just to close us out. Keith, your note about running the air conditioning all the time. We also have some energy saving, cost saving programs and opportunities for houses of worship that I'm going to let you know about in just a moment. So let me go back to just quickly sharing my screen. All right, so wanted to let you know about a partner event. So the Detroit 2030 district, they've got a house of worship green team that meets regularly, and their next event is with Energy Star. So those are the folks that help you save energy and save money in your congregation. So learn more about their program, and the link to join is right there, and Jennifer will drop that in the chat. All right, and then these are our two programs. So if your house of worship is a consumer's energy customer, we've got an energy saving program for you. Past participants, 800 houses of worship in Michigan have done this program so far, and they've received an average of $1,300 in free upgrades, and they're expecting to save hundreds of dollars each year on energy. You also get a lot of information how to move forward. The other program, again, for congregations that have members and friends who are consumers energy customers, there's a fundraising opportunity for you that deals with doing at-home energy efficiency. So you can learn more about both of those programs on our website. If your congregation has another utility like DTE or something else, we can also let you know what their programs are. So just contact us and we will help connect you. Lastly, we're doing some advocacy around climate voting. This is a really huge year for elections, and whoever we elect at all levels of government in November are going to be the ones to set the course for climate policy. So we think it's really important for folks from a faith values perspective are voting with climate in mind. And so we're asking folks to sign our Climate Justice Voter Pledge, which you can find on our website. We're also going to hold a part 2 of this webinar, and that's going to get into some of the worship planning elements of having a safe gathering space. The Episcopal Bishop of the Upper Peninsula, Rayford Ray, is going to join us. They've been doing some things with outdoor worship, and we're going to talk about stuff like that. So we will let you know when that is going to be. And that is all. So thank you once again, everybody. Thanks for staying with us, although we've gone over time. And thanks so much to our panelists. And we look forward to being with you again. All right. Bye-bye, everybody.
Thank you.